last but not least, I will really summarize the two types of awards that our society provides every year. So we are giving some awards for our young investigators. It's the ESCMID Young Investigator Award for Research in Clinical Microbiology and Infectious Diseases. And this year for this award I have 3 awardees. The 3 of them have the talks today from 11 to 12, but you may have the interest to speak to them or to get curious about what they work about. First of them is Monique van Wacht from Amsterdam, the Netherlands. She gave a talk on sepsis in the intensive care unit, epidemiology outcome host response. She's been working intensively in this area, in epidemiology outcome and host response in sepsis patients admitted to the intensive care unit. And in that area, she developed very nice studies in conjunction with other colleagues and doing multi-center studies. The second awardee is Jacob van Ingen from Nijmegen in the Netherlands. His talk was entitled Kill Them All, the quest for an antibiotic regimen that cures non-tuberculous mycobacterial diseases. Jacob has started to work on a severe polio outbreak that he could witness some years ago, and then after that he got interested in tuberculosis and did his final internship in Tanzania, where he developed some of the initial work in tuberculosis and came back to the Netherlands to complete his education and training. And the last one is Laurent Dortet from Paris, France. Laurent spoke about 5 years revolution in the rapid detection of resistance to lab-resistant antimicrobials. He's been working on different pathogens, starting from Listeria monocytogenes, but then turning to antimicrobial resistant pathogen, where he patented some biochemical tests for the rapid detection of carbapenemates and ESBL producers, and working also on type 3 suppression system for Pseudomonas aeruginosa, so trying to find new targets for potential treatments. And our most prestigious award for every year is the ESCMID Award for Excellence in Clinical Microbiology and Infectious Diseases. The record of awardees is impressive for this specific award, and this year the society decided to recognize the career and contributions of Ron Dagan. Professor Ron Dagan is a pediatrician. He works in Israel, in Ben Gurion University of the Negev. He was specialized in pediatrics in Israel and had a 3-year fellowship in Rochester, United States, and came back to Israel to form the biggest pediatric infectious diseases service in the country. He's been working on different fields, but he's mostly recognized for his contribution on pneumococcal infection and particularly pneumococcal vaccines. So he's been working on different aspects and large spectrum outcomes related to immunological and also clinical outcomes, but very interestingly as well, microbiological outcomes, like they interact between pneumococci and other bacteria and viruses, and how vaccines can modify that as well. He's also been doing research in many other areas, mostly in pediatric infectious diseases and in vaccines, and has been key to implement successful vaccination programs in this country. So for us, a big achievement to have been as an awardee for our excellence in clinical microbiology and infectious diseases. He was giving a talk today at 2:45 entitled Pneumococcal Conjugate Vaccines, the first vaccine against normal nasopharyngeal microbiota constituents. And I encourage you to assist to this presentation. I think that's all from our side right now, so we are happy to take any question or comments or suggestion from your side, as you may.
If anyone's got any questions, just say who you are and where you're from, please, and just stand at the mic. No questions at all?
All right, guys. My name is Piotr Kochan. You all know me. I'm from the World Journal of Medical Images, Videos, and Cases. And my question is related to the artificial intelligence in microbiology. Do you guys see only profits, benefits, or do you see some risks and dangers related to that? Because that's an issue which is raised by many organizations. Not only the benefits, but also the future risks when it comes to that?
Yeah, so obviously this is a moving target. I mean, the benefits are immense. The main risk that I see at the moment is that the field is moving very fast from a scientific perspective, but from an administrative and regulatory perspective, we're not yet able to absorb the technology, to validate it, to train properly our personnel. So I think that is the biggest risk. There is big promise, but one of the important aspects of actually discussing AI here at ECCMID is to make people aware of not only what the technology can do, but what it actually needs to implement it. So they need to think a little bit before jumping on this train. But it's definitely something that is going to be with us in the next years.
Thank you.
Thank you. Any other question? No? Well, if not, thank you very much. And as you know, we will have daily also press conferences about the specific abstract that will present on the specific day. Thank you very much.